Medicare Locals are here to help patients experience the health system better. So if we're serious about finding out about people's experience of the health system, we've got to do three things. We need to make sure our health system is patient focused. One way we can do this is by recording patient stories. We need to find out who's disadvantaged and what we can do to get them services, and we need to know what people's perceptions and behaviours are and how they interact with our system. To do that, we need market research. About 12 months ago, we started planning to undertake some research into the patient's experience of the healthcare system. We needed to know more about the health issues that were worrying Australians and how they were accessing our healthcare system. What were the barriers to people accessing healthcare? How did they receive their healthcare information? And what did they understand about chronic disease? So this is the first piece of research that's actually looked at the Australian Charter of Healthcare Rights and whether or not people feel their rights are being upheld in the delivery of healthcare services. We think this may be a more effective way of measuring people's experience of the healthcare system than traditional methodologies like, for example, patient satisfaction surveys. So our research told us some really interesting things. To start with, only 20% of Australians are aware of the Australian Charter of Healthcare Rights, and only 58% of them believe that those rights are being delivered by our healthcare system. So we took a close look at how people were behaving in relation to their healthcare providers and whether or not that would give them the assistance that they needed to get the best possible healthcare. The results show that we Australians don't always do the best we can to get the most from our health system. 51% of Australians never phone a practice after an appointment if they're unsure about what to do or need to follow up. 25% will only call sometimes. 46% of Australians will never give feedback on how an appointment has gone. 29% will only do it sometimes. 20% of Australians never discuss their options for treatment or referral. 38% only do it sometimes. 21% never prepare questions before an appointment, and 38% only do it sometimes. We're going to use this research in a number of ways. Firstly, it gives us a really good benchmark for where our system sits now and where we need to be, because obviously we want to get better. Secondly, we're actually going to use it for our local people, understanding what are the behaviours that drive their use of the system, how we can change those behaviours where they're not appropriate or they're not getting the best value for those individuals.